How do swallowing assessments help stroke patients? Imagine suddenly struggling to swallow your food or liquids after a stroke. Swallowing assessments are like a safety check that helps doctors and therapists figure out exactly what's going on with that difficulty. When someone has a stroke, the parts of the brain that control swallowing can be affected, leading to a condition called dysphagia. This makes it hard to eat or drink safely and can cause serious health problems if not managed properly. Right after a stroke, healthcare teams perform swallowing assessments to see if the patient can swallow normally or if there's a risk of food or liquids entering the lungs, which is called aspiration. These assessments are usually done within the first 24 to 48 hours of hospital admission. They include simple bedside tests, where a clinician observes how the patient swallows small amounts of water or food of different textures. Sometimes, standardized screening tools like the gugging swallowing screen or bedside swallowing screening test are used because they are quick, safe, and effective at catching early signs of trouble. Once the assessment is complete, the team can decide if the patient can safely eat and drink by mouth or if they need alternative ways to get nutrition. If swallowing isn't safe, patients might receive fluids through an intravenous line or nutrition via feeding tubes until their swallowing improves. This prevents choking and reduces the risk of aspiration pneumonia, which is a lung infection caused by food or liquids entering the lungs. Swallowing assessments are not just a one-time check. They help monitor progress over time. Repeating these tests allows healthcare providers to see if the patient's swallowing ability is improving or if adjustments are needed in therapy or feeding methods. This ongoing evaluation helps tailor rehabilitation programs to strengthen swallowing muscles and improve safety. For more detailed information, instrumental evaluations like video fluoroscopy or fiber optic endoscopic evaluation of swallowing are sometimes used. These tests provide visual images of how swallowing works and help identify specific problems. Based on these findings, speech-language pathologists and other specialists can develop targeted therapies, such as exercises or neuromuscular electrical stimulation, to help restore safe swallowing. By guiding treatment plans, swallowing assessments also help reduce complications like pneumonia, which can prolong hospital stays and worsen recovery. They promote a team approach involving speech-language pathologists, dietitians, and occupational therapists, all working together to support the patient's nutritional needs and recovery goals. In summary, swallowing assessments are a crucial part of stroke care. They help detect swallowing problems early, prevent serious health risks, guide safe feeding practices, and support rehabilitation efforts. Always remember, each patient is unique, and healthcare professionals tailor these assessments and treatments to individual needs. If you or a loved one experience swallowing difficulties after a stroke, consulting a healthcare team experienced in stroke rehabilitation is essential for safe and effective care.